Antonella, thank you so much for joining me for this interview here at LSI Europe.
Delighted, thank you.
Tell me a little bit about Altoida.
Altoida, it is a phenomenal journey trying to understand how we can use machine learning to basically diagnose, recognize disease pattern referring to the brain, and how to manage patients at best. There is a profound science behind it. And I can say that before my role as a chief medical officer, I was already advising Altoida on how to optimize the outcome of the science that the data scientists, neuroscientists were doing. And what we do actually, we train a machine learning model to recognize certain type of disease pattern that are specific to Alzheimer's disease and mild cognitive impairment. So once the algorithm is trained to recognize how the disease phenotype, the digital phenotype of the disease look like, it will tell you whether a patient coming in today will belong to that group or not. In theory, it can diagnose how the brain is functioning. It is analyzing basically the function of the brain in a 360-degree fashion because within a 10 minutes test that you can do using your mobile device, you can assess how the brain is functioning, whether good or bad, and come up with a piece of information that will allow the doctor then to manage disease further.
So is this using optical information or is it sort of a...
We are using optical information. We are using the sensors embedded in those devices to analyze, for instance, microtremors, how the patient or how the person moves in space and time. We analyze the eye movements, the speech, and all those features which are many, as you can imagine. It's not going to be only one. We're coming up with several features that are then analyzed by the machine learning, will come up in a result that consists of 13 cognitive domains that refer to certain type of skills, like, for example, gait or spatial memory, or, the ability of our brain to learn, the learning part, etc.
Identifying neurodegenerative diseases such as Alzheimer's early obviously changes treatment outcomes. So how early will Altoida help patients receive the care they need?
Well, I have to say that I am in the Alzheimer's disease ecosystem since I have started my journey within science and medicine. So what I can say is that what we learned, that the earlier, the better. Time is brain, brain is time. The earlier you diagnose, the more you can do about your medical condition. This is in general true for anything. For neurodegenerative diseases, it's particularly important because in our days, while we have some treatment that have proven to have an effect on cognition, such as the newly approved drug by FDA, aducanumab, we also know that there are preventive measures that the patient can put in place to diminish the risk of having the disease progressing fast or even delaying fully the onset of the disease, because maybe we can't revert the narrative fully, but we can delay that onset. And this is why a solution like Altoida that can really early in time recognize those subtle changes when you are not functioning as you should, and which me as a doctor can't because I don't have the skills that a digital biomarkers might have. It is certainly the way to go forward. And there is another piece that we need to clarify, and this is how to implement those digital biomarkers not only in patient management and diagnostic, but also in clinical development. I strongly believe, based on my professional expertise, that several trials in brain and mental diseases have been failing because the readout was not accurate enough. It was not sensitive and specific enough. It was prone to biases, intra-rater variability, inter-rater variability, meaning the doctor assessing for cognition, for example, in Bucharest, might have a different way of doing it from the doctor doing it in New York. So you have to do a lot of internal training and, standardized procedure. When you outsource to a digital piece of biomarker that can have that precise readout that will be accurate enough to remove the human bias that we all carry, then I think we will see a different outcome in clinical trial developments. And this is not only true for Alzheimer's, this is true for the whole, as I said, spectrum of neuroscience indication, where I think this is one of the major concerns. I think we have successful readout in disease area like oncology, like cardiovascular. You can measure the blood pressure very easily, right? And you can say if a drug brings it up and down. What do you do with the brain? I mean, I used to be a doctor in the ward, and I had to ask my patients about is suicidal ideation, why a person should respond to me as a young medical doctor back then with a truthful piece of information, with me having just few minutes to analyze all this. You know, if we outsource analysis of behavior, of functionality, of ideation to digital tools or wearable devices or even a piece of software as Altoida, then I think we have the right solution for the patients and for the doctor, because my frustration then was pretty high. It took me 6 months in one of the highest specialized medical center, at least 6 months, to diagnose Alzheimer's disease, and it was still a probabilistic type of diagnosis because the real one came post-mortem, right? So you can imagine how tedious the journey is. In neurological disorders, we have up to 2 years to 3 years, depending on the medical indication, time needed to recognize the type of disease we're looking at. And this is true for multiple sclerosis, for Alzheimer, for Parkinson, for ALS, which means if we can have digital biomarkers implemented in diagnosing, timing, and managing the patient, this is where I want to see the revolution happening.
So Altoida is not only early diagnostic, but it's almost like a co-diagnostic that can be used to personalize management and therapy of patients, correct?
Absolutely, because we can also then measure, and that's what we are doing with our partners, with our external stakeholders that are knocking at the door and they're asking to use the tool. We're also measuring treatment response. We're also measuring the effect of a drug over time on cognition, motoric, executive function, etc. And this is an objective measure that can be easily done because you can repeat the test actually as many times as you want. There is a minimum learning effect, if not neglectable at all, and it allows you to have repetitive assessment, even daily if you wish, whereas the current scales, they are tedious to be performed, right? I mean, they take time. You need a neuropsychologist performing the test, interpreting the result. Here you have an immediate result on the spot, or on whether your brain is functioning, on whether the treatment that you're taking is successful and how you're responding. I think that's phenomenal.
Absolutely. What's the first indication look like for Altoida, or are you working on developing digital biomarkers for multiple indications right now?
So where we already are available as a 510K exemption tool, it is being an adjunctive diagnostic aid to assess cognition. So we can already today measure the cognition and the functioning of the brain of an individual. This is but general, right? It's for cognition as an overall. What we're now trying to do, we're trying to become a diagnostic tool for diseases like mild cognitive impairment and mild cognitive impairment due to Alzheimer's disease. So the beauty of Altoida is that can tell you whether you have an impairment in cognition, like mild cognitive impairment that can be due to several types of reasons, right? Because you can have MCI due to depression, to lack of sleep, to problems with your thyroid functioning, different type of dementia. But we are trying also to become a diagnostic tool to assess whether your mild cognitive impairment is specifically due to Alzheimer. And how are we doing that? We are doing that by providing you with a result that will also assess whether you have amyloid or not in the brain. So the algorithm, the machine learning piece, can recognize whether you have toxic protein that it is accumulating in the brain by interpreting the result of a digital phenotype. And again, I think this is phenomenal.
Yeah.
And I believe, to your question, that while we are now targeting specifically Alzheimer, this can be implemented in many other disease areas. So we are exploring in our pipeline also opportunity for Parkinson, for ALS, for Huntington disease. I want to assess also ADHD in kids. We're going to get there.
That's exciting. You are a practicing physician, then an advisor. What brought you into the CMO role at Altoida?
Well, exactly this. The fact that there was a co-creation piece done even before having this specific role. I was advising the company on how to improve the science. And of course, as scientists, most of the things you do it pro bono. So I got passionate on what we were learning while this type of exercise was happening. And another things I've asked to the data scientists at Altoida was, can your digital device, can your machine learning tell me, because I'm interested in sex and gender precision medicine, whether the tool can distinguish whether the person performing the test has a blue brain or a pink brain, meaning it's a man or a woman, of course, without telling the machine learning beforehand the gender of the individual. And that's what Altoida also did, you know. So what brought me there was certainly the science, the atmosphere, the people at Altoida, because I think at the end of the day, it is the team that makes an organization successful. And the enthusiasm, the motivation of the people working to be successful in this journey, it is impressive. So if you ask me, how was your working day? For me, it doesn't feel like work, you know?
You have a great team at Altoida, and I am extremely excited to continue to follow the developments that you guys are making in neurotech. Thank you so much for stopping
Thank you.
by, Antonella.
Thank you.